What is ETS? ETS, or environmental tobacco smoke, is the presence of tobacco smoke in the air. It is the largest preventable cause of morbidity and mortality in the United States. It is especially dangerous in children and gives rise to a host of health conditions, including ear infections and asthma attacks, that can cause problems not only in childhood but well into adulthood. Nearly 50% of children aged 3 to 18 are regularly exposed to tobacco smoke. Smoke exposure statistics. Healthcare providers know that there is no safe level of smoke exposure. Over $4.6 billion is spent annually on childhood illnesses related to their parent or caregivers smoking. Secondhand smoke contains hundreds of chemicals known to be toxic or carcinogenic to human beings. And about 35% of children in the United States have been exposed to secondhand smoke. Smoke exposure causes 430 sudden infant deaths every year in the United States. Sources of smoke exposure. Children are most commonly exposed to smoke through the cigarettes, cigars, and pipes that are used by family members, caregivers, visitors, and others who are smoking around them. Recent action by several states and territories to prohibit smoking in vehicles while children are present has brought significant attention to the issue and the risks associated with childhood secondhand smoke exposure. Progress in reducing secondhand smoke exposure in non-smokers has stalled since 2011, and 58 million Americans are exposed to secondhand smoke, including 2 in every 5 children. Types of smoke exposure. Firsthand smoke is smoke that is inhaled directly from a tobacco product by the user of the tobacco. Secondhand smoke is smoke that comes from the tobacco product and it is in the environment and it is inhaled by the non-user. Third-hand smoke is absorbed onto the surfaces such as furniture. It exposes the non-user through a variety of ways, such as through their skin. The residue from the third-hand smoke lingers on the surfaces for weeks to months and it can re-enter the air. Children and pets tend to be the most vulnerable to the effects of third-hand smoke. Children in smoking. Most smokers usually start to smoke during childhood or adolescence. In recent years, smoking initiation has begun at even younger ages. Youth smoking is more prevalent among homosexual and bisexual youth. The problem only increases with time. One of the concepts that is important to know is that there are many new ways to smoke, such as Juuls, hookahs, and snuff. And children often see these new methods of tobacco use and smoking as a less harmful or less dangerous alternative to cigarettes. Specific childhood smoking statistics. Every day, approximately 4,000 adolescents begin smoking. 90% of adult smokers had their first cigarette before the age of 21. Almost 1 in 4 high school seniors is a current cigarette smoker, meaning they smoked within the last 30 days. Compare this to 1 in 3 young adults and 1 in 5 adults. Approximately 1 in 10 high school senior male students is a current smokeless tobacco user, and about 1 in 5 high school senior male students is a current cigar smoker. Risk factors for childhood smoking include being an adolescent boy, having family or friends that are smokers, abusing other substances, and being of low income. Risk factors for the effects of smoke exposure include children's rapidly developing nervous and immune systems are especially vulnerable to environmental hazards. Once they are exposed, children are much more likely to express toxic effects. Relative to their smaller size, children have a higher respiratory rate than adults, and children are much less able to detoxify the chemicals that are present in tobacco smoke, leaving them more susceptible to their effects. Signs and symptoms of smoke exposure. The symptoms of smoke exposure can last from days to years. Secondhand smoke is responsible for 150,000 to 300,000 lower respiratory tract infections in infants and children each year, resulting in between 7,500 and 15,000 hospitalizations each year. Secondhand smoke exposure may also cause buildup of fluid in the middle ear, resulting in 790,000 doctor's office visits each year, as well as more than 202,000 asthma flare-ups among children every year. Complications of smoke exposure. Secondhand smoke has been classified by the Environmental Protection Agency as a Group A carcinogen known to cause cancer in humans. The effects of tobacco smoke on the risk of asthma starts in pregnancy and causes persistent adverse effects on the lung function of children well into childhood. Parental smoking leads to atherosclerosis, also known as hardening of the arteries in children. This is a condition that does not usually present until adulthood, and it can lead to heart disease and stroke. Treatment. The best, most effective treatment for smoke exposure is prevention. Advise parents and caregivers of the health risks associated with tobacco smoke exposure in children. Advise adolescents of the risks associated with tobacco use. Educate parents and caregivers on the importance of non-smoking and/or smoking cessation, as well as on the types of smoke exposure. Refer parents and/or caregivers for smoking cessation treatment if desired.